In the midst of the second wave of the pandemic, where is the voice of the unions? Where are the unions? They're nowhere to be seen. There is no voice, no independent voice of the working class in the pandemic. We're seeing many major cities have gone into lockdown, but the pandemic, the infection rate, keeps on going up and up and up. Why is this? When cities enter lockdown, why is the infection rate going up? Well, it's clear that what is still driving infection is not what is being locked down. It is clear, the evidence shows that what is driving the infection currently is workplace infection, is manufacturing, is essential services. This is why one of the areas with the highest rates of infection is Brampton, is the Peel region of Ontario. Why? Because that's where manufacturing is. That's where the airport is. That's where a lot of essential services. That's where an Amazon warehouse is. That's where the infection is happening, not in the consumer environment as much anymore. And the capitalists do not care. The bosses do not care. They are profiteering of the lives of workers and working class families in these regions. And they're doing so with total impunity without organized labor and without the organized working class coming out and saying anything. And it is scandalous. It is totally scandalous. And we must fight the second wave. The working class, the organized working class must fight this second wave, because the capitalists aren't gonna and their governments aren't going to. They're not going to. Only we can do it. Only the workers can do it. And we must demand our organizations lead this struggle against the second wave, and the second wave of not just infection, but of deaths. Deaths are going up and up and up. It is a life or death situation. Now, some say, well, what can the unions do? What can the workers do? There's nothing to be done. Well, that answer in itself shows an ideological bankruptcy, a lack of imagination of how the workers can control production and control the pandemic. And what's more, this is not an abstract question, it is concrete. There is a very real example of how workers stop the spread of the virus. In the Thorncliffe Park area of Toronto, working class neighbourhood, has one of the highest infection rates in the province, highest test positivity rates of 16%. That's scandalous by itself. That's because these workers, they can't isolate in their house. They can't work from home. They're going out. They're going out and they're working retail. They're working manufacturing. They're working out in the community. They've got no choice. And that's why there is this 16% test positivity rate in Thorncliffe Park. Well, under pressure, the government agreed to do mass testing in the Thorncliffe Park schools, testing everybody, symptomatic, asymptomatic, everybody in the school, students, staff, teachers, everybody. And what did they find? Well, in fact, the infection rates were massively more than people expected. They initially found 18 students and 1 teacher infected. Later on, that rose to 26 students and staff. And immediately, correctly, the demand came down to close the school. Close the school. This is a disaster waiting to happen. And even more scandalously, the government resisted. The government resisted, both municipal and provincial. They said, no, we don't need to close, because the infection rate in Thorncliffe Park School is lower than that in the community. Now, this is scientifically incomprehensible, because the 16% rate in the community, well, that's symptomatic individuals. Whereas in the school, it was everybody, asymptomatic individuals. There is this asymptomatic spread going on massively and spreading the pandemic. But The governments, they even sent representatives on the media, on the radio, on the TV, say, oh, no, 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 this doesn't need to close. You just have to live with it or die with it. And courageously, what happened? Three teachers refused to go to work. Right to refuse unsafe work, or work refusal. They refused to go in. Now, like every time there's been a work refusal, the Ministry of Labour turns up or doesn't even turn up. Sometimes they do it over the phone and say, no, 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 everything's safe. You have to go back in. But by this time, this courageous action of the teachers created a movement amongst the workers, amongst the community, amongst the parents. And there was a massive demand to shut down the school. And the next day, rather than face a mass walkout, they were forced to shut down the school through the direct action of these teachers. As far as we can tell, this was a spontaneous direct action by the teachers themselves. It was supported by the union, but I don't think it was the initiative of the union. It was the initiative of the workers themselves. And now a whole series of schools in the Thorncliffe area and other working class areas have done this mass testing and have been found high rates of infection and have been shut down. That is an example to the entire labour movement. This is an example of what can be done and the necessary heroism that needs to be shown by workers on the front line to prevent the infection. Like these workers just said that my life and the life of my family is more important than any job. And by that they have saved the lives of many people by getting these schools shut down, these workplaces shut down. Why don't you know about this? Why haven't we heard more about workplace infection? Well, there is a deliberately enforced conspiracy of silence between the corporations, the government, and the media. There is a conspiracy of silence. In fact, you may not know this, but in the region of Peel, there was an outbreak, a whole series of outbreaks, but there was one especially large one that over 60 people were infected. Where did that happen, you may ask? No idea. They won't reveal the information. They are deliberately keeping this secret. Why? Because they do not want a public backlash and a worker backlash against these reckless, negligent corporations that are just allowing people to get infected. The corporations aren't revealing the information. The government is protecting that, keeping that secret. But most scandalously of all, the media is complying with this conspiracy of silence of these negligent corporations, these negligent workplaces that have mass infections. Utterly scandalous. They need to be named and shamed. We need to demand to know the names, demand to know the negligence of these bosses, how they don't care about the health and safety of the workers or the health and safety of the community. They are just continuing to profit. The profiteering, putting wealth before health, is scandalous. So, we don't know where it is, but the media, they're not trying to find out. It would actually be very simple for an investigative journalist to do some phone calls, look on the internet, find some of these people. If 60 people have been infected, that probably means there's hundreds of people in lockdown. It really cannot be that hard to find one of these people to tell you which was the business that had been shut down. But no, media letting it happen, letting it happen. The unions and the NDP need to be demanding every single one of these corporations' names be released. They must absolutely be released for the health and safety of the community so we can see what they're doing wrong and fix it. We can't trust the government to do that. No, they are complicit in the conspiracy of silence. Only the working class, only the organised working class can demand the necessary measures and keep them accountable. What else does the unions need to do? See, the unions are inactive. The union leadership, what are they doing? What are they saying? I haven't heard anything. It's incredibly minor. We need to be arguing for mass testing, mass workplace testing, like in Thorncliffe Park. So every major workplace, every workplace needs to demand mass testing. Like, you say you're safe, fine. Do mass testing. Find out if you are safe. If there is any more than incidental infection, well, that workplace has been proved to be unsafe and it needs to be shut down. If they refuse to test, there needs to be mass work refusals under the precautionary principle. If they refuse to shut down, there needs to be mass work refusals. And this needs to be supported by organised labour. This needs to be supported by the unions. The unions need to educate the workers over their power and give workers the courage to actually enact these work refusals and demand this mass testing. We need mass testing in all of the major workplaces. There needs to be a wake-up call for action. Wake-up call for action. What happens when we find infection in the Amazon warehouse, in the airport, in any other major workplace, in warehousing, in essential services? Well, you shut it down, and then the workers, together with the union, do a totally thorough health and safety review. Every single aspect of the work process. So, the assembly line, yes, there must be full distancing, full PPE, but not just there. Break rooms, lunch rooms, needs to be made sure that they are safe. And some corporations, some management, they argue, oh, we do all of the necessary PPE and distancing within the plant, and maybe they're correct, maybe they're true, but the workplace isn't this hermetically sealed environment. It lives in society. It lives in the community. So even though when the workers pass through the front door of the factory, maybe they're safe in the factory. Maybe there's all the reasonable precautions in the factory. But combined effect of low pay, shift work, transit to and from the workplace, poor housing, living in high rises, all the rest of it, the conditions of work end up promoting infection outside work. It makes no use if things are safe inside the factory, if to get there, the workers are forced to pack in like sardines on a bus with 50 other workers. That's going to ensure infection, right? Or in very poor, cramped housing. That's going to ensure infection. So there needs to be a holistic review of the role of the workplace, the role of low pay and shift work and transit on infection. Carpooling too. All of these things promote infection. And until all of those aspects are dealt with, then the workplace does not reopen. Until the workers are satisfied that it is safe and all aspects are safe, the workplace does not reopen. Absolutely essential that the unions demand this. We must demand this if we are going to fight the second wave. Otherwise, it's just the infection rate is going to keep going up in December, in January, in February, in March. It will go up and up and up, and more people will die. More and more people will get ill. There's lengthy health repercussions. We cannot trust the capitalists. We cannot trust the state. We definitely can't trust the media. We have to organize this ourselves as the working class and demand that the leaders of the unions do their duty. It's got a wake-up call. Only the organized working class can fight the pandemic. You could say, oh, this is all going to be very expensive. It's going to be all very expensive. The big bosses, the billionaires, are bringing home billions and billions. Latest report showed that the top 44 billionaires in Canada have increased their wealth by $53 billion from April to October. $53 billion. They've got the money to do all of this. They just don't care. Actually, where did they get that money? They got that money by exploiting the workers who are forced to risk their lives in production. Scandalous, utterly scandalous. We make the bosses pay. We've got to make the bosses pay to end the pandemic. And the trade unions need to be demanding this. Program of action. Here's the program of action. 1, release the names. What are the businesses with outbreaks? Name and shame. 2, mass testing. Mass testing in all the workplaces to find out where these workplace outbreaks are occurring. And if they refuse to mass test, precautionary work refusals. 3, shut down any workplace with significant infection rates, more than incidental infection rates. They've got to be shut down and a proper review. Work refusals. If they refuse to shut down, support for work refusals of the workers. If there's mass work refusals and mobilisation of public opinion, just like Thorncliffe School, then they will have to give in to our demands. Demands for the health and safety of the community. None of this secrecy anymore. Work refusals. And finally, worker union controlled health and safety reviews, holistic, that take in all aspects of the production process, break rooms, and the effect of the workplace on the community, transit and housing. Only then can we really put paid to the pandemic. Only then can the working class show its power in ending the pandemic against the negligent profiteering of the bosses assisted by the government and the media. It must be done. Lives are on the line. Get it done and demand our union leaders act today. Thank you.